Hi, good afternoon, everyone. Okay, good afternoon, ladies and gentlemen. Welcome to the webinar collaboration series by KulOn and Great Global Hanlyn with the title of Pursuing Career as Doctor in UK. My name is Tia from KulOn. As a brief introduction, KulOn is an e-learning platform for medical students, nursing student, midwifery student, as well as dentistry student. As a platform, we provide learning materials that is accessible from everywhere by anyone. Okay, in today's webinar, we collaborate with Great Global Hanlyn to provide you with the information about how to pursue career in UK. And in this event, which is the latest registered participant is 421 participants. We hope that all the participants will be joining us as soon as possible. And we hope this program will enlighten you with the information you need for your future career. Okay, let me show you some schedule for today's webinar. Wait. Okay, so we welcome you all. This is our today's agenda, which is the first one. We would like to hear the presentation from Dr. Charlotte, and then the second one is Dr. Sam, followed by Dr. Celynka and also Simon Yates. Okay, I think we may proceed as soon as possible. Hi, Dr. Charlotte. Can you unmute yourself?
Yeah.
Okay, sure. Hi, how are you there?
Good, thank you. How are you?
Thank you. Very great today, as we can see you through our webinar series today, as well as very great that we will hear some new information about how to be one of general practitioner there in UK.
Yeah, lovely.
Okay, for all the participants, maybe some information about Dr. Charlotte. She is a general practitioner, is that correct?
Yeah.
Yeah, she's a general practitioner. So untuk teman-teman di sini, beliau adalah dokter umum. Jadi untuk rekan-rekan sekalian yang seorang dokter umum, if you're a general practitioner, you may also ask as much as you want in the chat room box about how to pursue career as general practitioner. Okay, I think without any further ado, maybe we can proceed for your presentation, Ms. Dila. Can you help me?
Yeah. Lovely.
Sure.
Lovely. So can people see my presentation at the minute, or?
Yes, the presentation is on.
Yeah, lovely. Okay. So I'm Dr. Charlotte, and as has already been said, I'm a general practitioner in the UK. So I'm currently working in Birmingham, and I work as a salaried GP 3 days a week. So I don't think I can see my presentation, but I'll talk through on my other screen. Oh yeah, there we go, lovely. So I'm just going to have a bit of a chat about general foundation training in the UK and then going on to specialty training. So usually in the UK, so as we come to the final year, the end of the final year, we'll apply for the foundation training, which is once we've qualified as a doctor, we'll apply for our next jobs. And usually once people have finished their medical degree, that's when we can apply for what's called the 2-year foundation training program. There is a website that people in the UK and outside the UK can access, so they're able to see what the eligibility criteria is and how to apply to train as a doctor in the UK once you've completed your medical school. Next slide, please. Okay, so the training is throughout the whole of the UK, and candidates get asked to rank all of the different foundation schools according to the location, so where in the UK you want to be living, and what jobs you want to do. And then you get ranked essentially according to your educational performance and your situational judgment test, and then you'll get allocated a 2-year training job from there. Next slide, please. Okay, so the first year of the 2-year foundation program is called Foundation Year 1. So you might see this on documents known as FY1 or F1. And I think it's the equivalent of an internship in other countries. So it's usually 3 lots of 4-month placements in different specialties. And these can be absolutely any specialty in medicine usually. And once we've finished our FY1 year, then you'll have a full license to practice from the GMC. Next slide, please. Okay, so Foundation Year 2, as long as you pass all of your competencies and at the assessment at the end of Foundation Year 1, people are happy for you to proceed, which is usually the case. You'll go on to Foundation Year 2 or FY2. And this is usually just an extra year before you apply to specialty training in some other specialties. And this again is 3 lots of 4-month placements. Now, during the foundation year, you'll get both an educational supervisor and a clinical supervisor. So you'll get 2 doctors that you'll be working with throughout the year, who is your go-to point for any help, any questions, and essentially they'll check in with you 3 to 4 times a year to see how you're going. Next slide, please. Okay, so after you've completed the foundation training, the next step is applying to specialty training. And this ranges from between 3 and 8 years, depending on what specialty you choose. On the end of the specialty training, you become a general practitioner, which is what I am, or you become a consultant in that specialty that you've chosen. Each specialty has different exams, and it all depends on which Royal College and which specialty you are as to what exams you need to pass. And it's usually a national recruitment, so it's usually throughout the UK that you'll apply for a job. Most people will opt for places where they want to live, but sometimes because the specialty training is quite challenging, sometimes you do have to compromise on location. Next slide, please. Okay, so this is just a general overview that I've got from a website called the savvyimg.co.uk. So really good website, and essentially this is looking at, so once we've completed our medical school, we do the 2 years foundation training program. You then apply for specialty training, and you do between 3 and 9 years of the specialty training program, and then you become a consultant or a GP. And after that, if you want to, you can apply to do further training depending on what your interest is. Next slide, please. Okay, so the types of training, so there's one called Uncoupled Training and one called Run-Through Training. And I'll talk a little bit about those in the next slides about what the difference is. But I think the important things to say are each training is run by that specific Royal College. So for example, my training was through the Royal College of General Practitioners. If you do medicine, Royal College of Physicians, etc. And our training is a paid doctor's job. So from the start of your foundation year, you are getting paid as an NHS doctor, and you're working as an NHS doctor. So it's essentially training on the job. Next slide, please. Okay, so uncoupled training is essentially training where you'll do a basic training for a couple of years and then apply again for a subspecialty. So it's usually 2 to 3 years in the basic training program. And some of the specialties that do this include internal medicine, a lot of the surgical specialties, and the others you can see there on the screen. And the idea with this is that, particularly for medical trainees, a lot of people will want a general broad spectrum idea of what different parts of medicine are, and you'll rotate through different medical specialties. And then once you've decided which specialty you want to then continue with, you'll then get reapply to that specific specialty. Next slide, please. Okay, and that's just a picture that describes how that works. So you'll do a couple of years in what's classed as core training, and then you'll reapply to the specific specialty that you want to do for another however many years until you complete that training program and become a consultant. Next slide, please. Okay, so the other type of training is run-through training, and that can last for 3 to 7 years. And essentially what this means is you apply after you've completed the foundation programme, and you don't need to reapply at any point until you pass and become a consultant. And these are some of the specialties that you can see. So paediatrics, obs and gynae, etc. Next slide, please. Okay, and again, this is just a graph showing that. So once you've done the foundation programme, it's just one application to the specialty. And as long as you pass all of the competencies over the years, you'll then become a consultant at the end of it. Next slide, please. Okay, so all of the training includes different hospital rotations. And this will usually be in one specific area. So for example, I've done my training in the West Midlands, so I've stayed in the different hospitals around the West Midlands. And it depending on what specialty you choose, the rotation can be 6 months or all the way up to 2 years before you rotate to a different specialty. And throughout your training, they do try to send you to smaller hospitals and much larger hospitals just to get a different experience in the two. Next slide, please. Okay, so there's no training fees, so we don't have to pay to be trained as doctors once we've completed medical school. We get paid for that, but we do have to pay for certain fees. So we have to pay every year to be part of the General Medical Council. We have to pay for medical indemnity, and often people will choose to pay to become part of a union, such as the British Medical Association. They help with any rota concerns, things like that. And also you have to pay to be part of the Royal College in which you're specialising, because often you get given an online portfolio. Your exams are through these colleges, so they're the additional fees that you would have to pay for. Next slide, please. Okay, so I think I mentioned earlier, so applying to specialty training is competitive, and there are different things that you have to pass to apply, and it depends on different specialties. So for example, in the general practice training programme, we had to do an online test before we got invited to a face-to-face interview. And then the face-to-face interview included a practical type exam, just very simple, common scenarios that we would see in general practice every day, and then you get scored out of that. And different training programmes will have different criteria to pass. Once you get given or accepted onto the training programme, you get given a national training number, and year on year, it's an automatic progression as long as you meet the training requirements. So depending on what specialty you're in, it will depend on, you know, how many numbers of procedures you do or what specific things you have to do to pass. Next slide, please. Okay, so the working schedule. So unfortunately, you don't get to choose your rota. You get allocated a rota, and it does depend what specialty training you do as to what your rota is like. You should get your rota 6 weeks in advance so that you can plan essentially life events and things around that. Most people will work a typical Monday to Friday working week. However, depending on what specialty you choose, there's often out of hours work there as well. So that will include some evenings, some nights, and some weekend works. And your salary will depend on a basic salary plus how many of these unsociable hours you'll do. So if you work a lot more night shifts or weekend shifts, you'll get paid more than another specialty who will just work sort of a Monday to Friday working day. You also get the option to take study leave, annual leave, that type of thing, and that is paid as well. I'll talk a little bit more about that next. Next slide, please. Okay, so this is just a little bit more about the rota. So I know lots of different countries have different rota requirements. And in 2016, one of our defence unions actually negotiated to make the rota a little bit kinder. So sometimes it is still quite hard and challenging, but it brought in some rules that the hospitals should follow so that we're not working 2 weeks straight on call and things like that. So it's an average 48 to 56 hour week with a maximum of 7 continuous days working. And the maximum length of a shift you can do is either 13 hours, or if you're classed as a non-resident on-call, so you can do an on-call from home, then you can have a 24-hour on-call period. And you can see on the screen there's also rules about rest periods following shifts and on-calls. And essentially that's just to protect you and to protect your physical and mental health, and make sure that you can train and be well rested at the same time. Next slide, please. Okay, so there's lots of benefits of working in the NHS. So NHS is the National Health Service, and the idea is that everybody gets free healthcare, particularly at the point of access, but if the doctor deems that you need any tests, investigations or treatment, all of that's free. There is an option in the UK to also pay for treatment. That's different, but all of the training is done in an NHS hospital, so a National Health Service hospital. So lots of benefits of working there. So one includes paid leave. So you're entitled to a certain amount every year of annual leave, sick pay, maternity pay, paternity pay, parental leave and study leave. And I'll talk a little bit more about those. As a trainee, you also get paid study sessions and you also get an allocated study budget. Now that does change year to year. So I think my last year of general practice training, we had £400 each to spend on a study budget. So we would use this for courses and conferences, and anything over that you'd pay for yourself. You get the option to join an NHS pension, which is one of the best pensions in the UK. And you also get access to lots of different discounts. So shops, restaurants, different services will give you discounts just for working for the NHS. Next slide, please. Thanks. Okay, so just a little bit more. So starting from your foundation years, you get 27 days paid annual leave a year. Oh, sorry, there's a question come through. Okay, so I'll answer some of the questions afterwards, I think, once I've spoken through about the training. Okay, so annual leave, you get paid annual leave and paid bank holidays, and everyone is entitled to that. Next slide, please. And you get approximately 30 days study leave paid each year. Now, depending on what training program you choose, depends on, often you'll have allocated weekly or monthly teaching sessions that will use some of those study leave, but you'll also get separate time to attend conferences. Okay, next slide, please. So yeah, this is just talking about some of those. So for general practice training, we had half a day a week where we were allowed to leave our training job to go and attend the regional teaching. So, you know, all together we were taught on specific subjects each week. And you can use some of the study sessions as well to undertake audits, which you have to do most years of the training, presentations, publications and things like that, which are all things that make you sort of more employable once you've completed your training. Next slide, please. Okay, so benefit of the NHS, you get parental leave. So each child you have, you get over 18 years of their life, you get 18 weeks of parental leave. Some is paid, I think it's only a couple of days a year, but you do have the option to take unpaid leave if you do need to for family requirements. Next slide, please. Okay, so I know this is of interest, so salary. So it's equal, there's lots of emphasis on equal rights in the UK. So whether you're male or female, whatever ethnicity, religion, anything like that, everybody gets paid equally for the same job. So all of the foundation trainees will start on a basic salary. And then depending on how much of that weekend or night shifts you do, you'll get a slightly raised salary. And as you work through the specialties, your salary will go up to obviously when you become a GP or a consultant. There is the option to go part-time, and obviously your salary will drop depending on how many hours you actually work, but it just gives a bit of flexibility for people. Next slide, please. Okay, so this is just a little bit more in detail about the GP training program. So all of the training programs are different for specialties, so I don't have lots of in-depth knowledge about all the different specialty programs. So I applied for both obstetrics and gynecology and GP training, and then I got offered both jobs, but I ended up taking up GP training. And this is essentially what we do. So it's the shortest training pathway from the end of foundation years to completing the training. And it's a 3-year training program until we become a GP. And you do have the option either during the training program or afterwards to develop special interests. So I have special interests in family planning and women's health. So throughout the training, I've done additional training so that I can offer my practice extra work in that way. And that's what I enjoy as well. Next slide, please. Okay, so I know that not every country has a general practitioner. So essentially, it's also known as a family doctor or family and medical doctor. They look after the whole body. So from top to toe, from birth to death, for any medical problem that you can have. People in the UK will initially go to their GP for, other than emergencies or accidents that go to emergency medicine. So from headaches, pregnancy, anything like that, people will initially go to the general practitioner, and then if you do need to see a specialist after that, the GP will refer you. So as I've said, it's a 3-year training program, and it's usually made up of either 9 4-month placements or 6 6-month placements, and they'll rotate through different medical specialties, so that you can get, because we cover the whole of the human body, just to get a bit more information there. Next slide, please. Okay, so there's lots of different options in your GP rotations, but it essentially covers a lot of the medical specialties, surgical specialties, and the others that you can see there on the list. So the idea is that you come out of general practitioner training, not just being able to work in a practice, but also having some experience of the other specialties as well. Next slide, please. Okay, and so this is just a bit more specific about myself. So I graduated from KulOn Medical School in 2013. I undertook my foundation training in the West Midlands, which is the Birmingham, Staffordshire area. I did my general practitioner training in the West Midlands, and I'm now working in the Birmingham area as a general practitioner with special interests in women's health and family planning medicine as well. Next slide, please. And this is just to get a bit more information about the training. So my experience of foundation training, so in my first year, I did 4 months of colorectal surgery, 4 months of respiratory medicine, and 4 months of pediatrics. And during that, you get the opportunity to work on the wards, undertake procedures, and you also have on-calls as well in both the medicine, but also the surgical specialties as well. Next slide, please. So for my next training program, I moved a bit closer to Walsall for my second year, and I did obstetrics and gynecology, general practice, and endocrine medicine. And once I've completed that, I was then able to apply for specialty training. Next slide, please. Okay, so my GP specialty training was all in the North Midlands area. And the rotations that included was psychiatry, emergency medicine, sexual health, and general practice. And that's where my interest in women's health and family planning have come from. I've been able to gain additional exams and things like that during my training in those areas. Next slide, please. Okay, so that's the end of my presentation. These are some of the references that I've used. I would really recommend that everyone takes a good look at the savvyimg.co.uk. It's specifically for international medical graduates, and it's got lots of information there that I think would be really helpful. And then the others are just the BMA, which is our defence union, and NHS employers as well. Okay, so I'll see, yeah.
Okay, very great presentation. There's some actually try to send me message about the rotation system there. It's very interesting because it's very different from Indonesia.
Okay.
And also some of the participants try to send me message about the salary, also interesting there.
Yeah.
Okay. Okay, we would like to proceed with the next speaker. Maybe
Yeah,
for
okay.
all the participants, if you want to ask for Dr. Charlotte, she was talking about the working system as doctor in the UK and the experience of being general practitioner in UK. You can type your question in the chat room so that Dr. Charlotte will see the question as well as answering them in the discussion session, right?
Yeah, okay.
Great.
Okay,
Okay.
so
I think we would like to proceed with the next speaker, which is, I think, her husband. Am I correct?
That's correct.
Yeah. So here we have Dr. Sam Al-Araji. He is a neurologist. Am I correct, Dr. Sam?
That's correct, yes.
Yes. So in this webinar, in this session, Dr. Sam will talk about the working culture as a doctor in the UK and the experience, his experience of doing the PhD in neurology in UK. So if you're interested on doing the PhD, I think there are some questions about specialty too from the registration form. Maybe we can talk about that later in the discussion session. I guess this is your time. The floor is yours.
Thank you very much. Can you see my presentation?
Yes, perfect.
Yes.
Fantastic. So, again, my nickname is Sam, and my full name is Samed Al-Araji. So, I am one of the current neurology trainees in the UK, and currently doing a PhD in London. So Charlotte has given a very thorough presentation on the training system in the UK, and I'm going to be an example on how I've gone through the different levels and different training years since 2012. So just a bit of a background about myself. So originally born in Iraq, Baghdad, the capital, and moved to the UK with my parents at age 17. So that was just the year before getting into university in the UK. So I went through the English language learning and doing the A-level for 2 years, and then obviously applied for medicine, which is what I wanted to do. And in the UK, you do a medical degree over 4 to 6 years, depending on which university and what other qualification you may have had previously. So my training was 5-year university. So I did that at KulOn University, and I graduated in 2012. So just going through, so at the end of university, so the final year, we apply for foundation training, which is what Charlotte mentioned earlier, which is a 2-year program. Each year you can rotate between 2 to 3 specialties, depending on what specialties and which place, which city, which hospital. But the majority of these training programs are 4 monthly specialties. So again, as Charlotte did, I trained in the North Midlands at Royal Stoke University Hospital, which is in Stoke-on-Trent City. And my first rotation was in stroke medicine. So that was very interesting because I wanted to do something to do with in neurosciences, whether that is stroke, neurology, or neurosurgery. So that was a perfect start. You get an exposure to kind of the acute or hyperacute stroke service for people depending on the timing of the stroke onset. You go through the thrombolysis or the clot busting procedure, whether that is via medicine, or at the time in 2012 we were introducing the thrombectomy, which is the mechanical retrieval of the clots. So that service was fantastic to be part of and getting that exposure. Although I was the most junior person of the team, but everybody is involved and everybody takes part because we work as a team. And despite you are a trainee, you are part of the team and you treat patients. So that's how it works. And then so that's the acute part of stroke, and then you also deal with the chronic part of stroke, which is rehabilitation and physiotherapy and occupational therapy parts of management. So you spend a lot of time as a junior trainee on the ward managing all these patients, but also you have the opportunity to go to clinics to manage these patients, to see them after a few months to see how well they are doing, or not so well, depending how things are going. So that's my first 4 months. The next 4 months I spent it in surgery. So you do mainly general surgery, but I was based on upper GI surgery. So dealing with esophageal problems, gastric problems, in terms of cancers, bariatric surgery. So I was not particularly interested in surgery, but importantly, I had the opportunity to go into theatres, help and assist the senior trainees or even the consultants. So depending on what you'd like, what is your aspiration in the future, you get the opportunity to do anything really you want. I'm just going to move on again to the final 4 months, which is anaesthetics, and that's specifically what I chose to do, or these are 3 things I wanted to do, because anaesthetic is one of them specialties that you really need as a junior doctor, to get you all the skills to learn everything that you need in terms of the cannulation, in terms of assessing the patient and managing airways, which is the first and foremost for any emergencies that you have to deal with, which is something that I really found it very, very useful for my future, and when I kind of got more experience and more senior over the years. In terms of my second year training, I stayed in the same hospital. Some people are able to move to other hospitals or other cities, depending on which rotations you chose, and what your career aspiration again are. So because I wanted to do neurosciences, I chose the neuroscience in my second year, which is neurosurgery, emergency medicine, and neurology. So neurosurgery, you get the chance of dealing with, obviously, and Stoke-on-Trent is a trauma center, so any brain injuries come to us. So you deal with that in emergencies and taking patients within, minutes into theatre, and you operate, whether that's a brain or spinal cord problems. But also for a tumour and cancer service, which is an excellent service in the NHS. We have what we call a 2-week wait. So anybody who's suspected brain cancer or spinal cancer, they get seen within 2 weeks. The majority is seen within that week. And then they get operated on, or the first treatment they get given within 31 days, so within a month, which is a fantastic service. And that's all for free, as Charlotte mentioned. So that was a fantastic experience in terms of training, learning surgery, as well as the medical and neurology in surgery, which is how to examine patients, what signs to look for. So that was really useful, again, for what I wanted to do. And then in emergency medicine, that was 4 months spent in A&E, essentially. So you deal with all the emergencies in terms of medical, surgical, ophthalmological, anything you can think of. So you are the front line. Again, it was a trauma center, so you get to spend time with trauma, but also you can be spending time, if you have interest in pediatrics, you can be in pediatrics A&E. So everything is there if you need. And then the final 4 months was in neurology. So that was what I wanted to do, because in the next step is going to be what you want. You choose what you want to be, whether medical, surgical, or GP. Because I wanted to do medicine and neurology, I kind of planned this to be done at the end of my foundation training. So neurology was what I wanted to do in the future. And also, it's not that just what I wanted to do. I just wanted to make sure that I was going in the right direction and train in the right area and get exposure to specialty training and consultants, what their life is like and what they have to train as and what they have to go through to be able to train and get the experience that's required to be a consultant at the end. Importantly, so the application to apply for the next step, it starts at the start of the second phase of the second year. So when I started emergency medicine in December, that was the time when you start applying for core training or the other training, the higher training. So you have to be very careful about planning way in advance. So if you want to do something, or if you have plans ahead, most things need to be done. So for example, audits, presentation, publications need to be done in the first year or the start of the second year. So you can have you count all your hard work towards your application. You can do a lot of other things, for example, in the final part of the second year, but unfortunately that will not be counted towards your application. So everything needs to be planned way in advance. The next part is my core medical training, which is the path that I needed to get into neurology. For example, Charlotte at this stage, she applied for as a general practitioner, so the GP training program, which is 3 years, whereas I decided to get the medical part, which is 2 years of core medical training, and then obviously the neurology training, so specialty afterwards, which is 5 years. So in core medical training, I decided to stay where I applied to get to London to train in medicine in London, but I didn't get the jobs that I wanted to get me into neurology. So I decided to stay where I wanted to stay and get the jobs that I want. So you always have to make that compromise or choice where and which specialty throughout all training. So the first year of my core medical training, I did respiratory medicine, and it was fantastic because you get exposure to managing the acute stuff like asthma, COPD, and also get to do a lot of skills in terms of putting chest drains, doing a pleural tap, diagnostic and therapeutic, and also managing the chronic diseases in COPD and asthma in clinics. But throughout the 4 months, you get the chance to go into other specialist things, like, for example, watching bronchoscopy being done for diagnostic or therapeutic. So that was really helpful. And also, as I said, putting chest drains, which is a requirement as a trainee to achieve, to progress. But you get to do that throughout your training. My next 4 months was diabetes and endocrine medicine. It's mainly a general medical thing on the ward that you see everything really. You see respiratory, you see gastroenterology, you see cardiology, but you get to go to clinics to see more the endocrine part of it, which is, the thyroid problems, the diabetes problems. So very, very wide range of experience within that 4 months. And then the final 4 months of my first year of core medical training, I spent it in acute medicine, which is, I did it in a different hospital, a nearby hospital, a very small general hospital. You get to see all the acute medical stuff again, with a variety of medical experience like the stroke, the gastroenterology, cardiology, respiratory, diabetes, anything really. That was very good in terms of setting you up to get more experience and get more advanced for your higher training. But that was an example of sometimes you spend a lot of training in one hospital, where you get sent to a different nearby hospital to get further training, see different population, different sort of people with different backgrounds, and different services available, and different resources, and how you manage all that. In year 2, I went back to Royal Stoke, and I did intensive care medicine for 4 months, which was very helpful. Again, dealing with emergencies, but also dealing with the sickest of patients. Obviously, it comes handy with the current pandemic and having to deal with a lot of difficult decisions, but these are all training that you get throughout the specialty, which is fantastic. But also, I learned a lot of skills in terms of assessing the really, really sick patients, doing the ABCDE approach, and also putting lines like central lines, doing lumbar punctures, all of these skills that you need to progress with your core medical training to go into higher special training. My next 4 months were quite very, very different to intensive care, which was rheumatology, which is hardly anything acute other than kind of the acute joint, but it was mainly a clinic-based training. So you see all the kind of the rheumatoid arthritis, the osteoporosis, all the rheumatological joint problems, but also you get to spend some time to learn how to inject joints, mainly knees and hips, but you can inject any joint. But that was, I did that in a local, very, very small hospital that was designed for rheumatology services. So it was away from the Royal Stoke main hub, but it was a smaller hospital that I just traveled to and back. And then finally, again, I planned to do this in neurology again, although it was too much neuroscience in my training, but there was a lot of other variety. But because I wanted to do a neuroscience, I planned this to do a lot of exposure. So I am prepared for my higher training in terms of knowledge, skills, and kind of understand the system better. I'll come to neurology specifically more next, because that's what I've been doing in the last 3-4 years. But importantly, as you can see, at the start of my rheumatology, which is kind of again the December of each year, or the final training year, you get to apply for your higher specialty training, or the SPR years, if you want to be a consultant at the end of your training. For example, in neurology, in rheumatology, in respiratory, in gastroenterology. So, as I said before, this is a critical stage where you have to submit an application, and all your hard work that you've done before needs to be obviously written down and stated at this stage. So everything needs to be planned way before kind of the final part of the second year training. So throughout this training, most consultants or the trainers, the culture is get you trained as best as possible and get you to do as many presentations, get publications done, do audits, and get you more points on your applications. So I remember in my first ever job in stroke medicine, as I mentioned before, I worked with my consultant who was very helpful to get a lot of work done for stroke patients. And I managed to get a poster to be presented internationally at a stroke conference. And that gave me a lot of points for every single application that I did after that. So it's very important that kind of training, communication with the trainer, and that culture of getting things done early and planned in advance to get all the points to show your hard work. So that's 4 years of my training post-university done. So now into the specialty training in neurology. So again, once I applied into the specialty, I got an interview. Well, thousands of people get an interview. Thousands apply. A few hundreds get interviewed, and depending on which specialty you get into or you apply for, there will be a smaller number of successful applicants into that training. So a lot of people apply for many specialties and what they want, and then they may do according to their CV. So I've done a lot of neurology, so I was unlikely to get a job in, for example, gastroenterology when I've not really done anything. But I was kind of better situated or positioned for somebody who's not done as much in neurology in the last 4 years. So again, in my first and second year of training, which is ST3 and ST4, so that's specialty training 3 and specialty training 4, I spend my neurology training, again, the same hospital, Royal Stoke. This is uncommon to spend a lot of training in the same or surrounding area in Stoke-on-Trent, but it's kind of a choice and it kind of coincidence. So not always, you don't always get what you want, but if you work hard and you tick the right boxes in your application, you get the right job in the right place. So within my first 2 years of training in neurology at Stoke-on-Trent, you get to experience, well, you train in different subspecialties, including headaches, movement disorder, neuroinflammation like MS or Behçet disease, and epilepsy. So these are the 4 main subspecialties that was allocated in this area in Stoke-on-Trent. So you spend a few months in each subspecialty, you work with that consultant with that experience, and you learn quite a lot. So you work with the acute team, so you are on the rota to manage these as a registrar or an SPR, to manage acute neurology patients referred from the emergency department or from other wards or other specialties. And then you also have allocated time to attend clinics with that specialty, with that consultant. So you learn, you gain a lot of experience. And obviously, if you have an interest in, for example, epilepsy, you are free to spend more time or few more months in that specialty if you like to. As long as you communicate and you show your interest in that particular specialty. So communication is key in everything you do and planning ahead. So my 3rd year of training, so because I gained quite a bit of experience in major subspecialties in epilepsy, in neurology, the next bit, which is a different city. So in neurology in the Midlands, for example, over the 5-year training, you have to spend your training over the 5 years in at least 3 different hospitals. For example, we have Stoke-on-Trent, Birmingham City, Birmingham Queen Elizabeth. There's Birmingham City Hospital in Sandwell. There is Coventry, that's a different city. And there's Wolverhampton, so that's a different hospital again. So these are the 5 main sites that you can spend your training at. So far I've done 3 years and I've only done 2 placements. So I'm looking forward to wherever I'm going to be, which is Coventry or Wolverhampton in my final 2 years. So what was special about Queen Elizabeth Hospital is essentially you have the super subspecialties. For example, there's epilepsy surgery service, which is, although the neurologists don't operate, but they essentially plan everything in advance for whoever is required to have epilepsy surgery, and then tell the surgeon, now you can operate, essentially. But that experience of working in a multidisciplinary team, working in different specialties, and that communication with the specialist nurses, working with the surgeons, working with the epilepsy specialist nurses, and working with the neurologists, all work together. So they meet every week to plan whoever needs surgery, whoever has surgery and how they are, and so on and so forth. Now, when I finished that year, or during that year, I planned to take some time out of program, which is something that you can do throughout your training. So you can do it from year 1 to year 4 of specialty training. You can't do it in the final year of training, unfortunately, which is taking time to do research. So it's something that has always been kind of historic. People would like to do it because it gives you a lot of more experience in managing patients in that specialty. B, getting you to learn more about academia and how to interpret evidence. And C, getting you more points into your application or your CV to show that you've gone the extra mile and that you've done extra things. So that will help you in terms of the future and where you're going to apply once you finish training in terms of a consultant job, what subspecialty you want to get into and where. So all these, essentially, that's a bonus if you are able to do it, which is available if you are interested. So so my work has been I spent the last 12 months in London, in Queen Square, even though myself and Charlotte we live in Birmingham, but it's all we commute either by car or train. Everything is connected very well. Although it's been very hard work, but hopefully, I don't know yet, it'll be worth it. Based at Queen Square, which is the National Hospital for Neurology and Neurosurgery. So my job is as a clinical research fellow for 3 years, working on a study. And during this 3 years, I'm planning, or I am doing a part-time PhD, which is a degree I will be getting from the University College London, UCL, and it's paid. It's type of the study that I am studying, researching, and being paid, which is very very important to get that. So again, the reason why I'm doing this is trying to gain more understanding about research, academic experience and skills. I want to get better knowledge in the chosen subspecialty, which I've decided to do multiple sclerosis and neuroinflammation as part of my subspecialty in neurology. But also importantly, I would like to, what this experience has given me is networking with other specialists in MS or neuroinflammation, nationally in different national centers, but also internationally. So I've been on courses in Europe. I was planning to go in the United States this September, but obviously because of the pandemic, everything is virtual. So you get the opportunity to go to a lot of conferences and courses throughout the year, which is most of the time is funded for. So it's very, very good. So I'll spend a lot of time giving you an example of my last 8 years of being working and training and being in the NHS. As both, to be fair, living in the UK, working and training in the NHS. I'm also an NHS user, so you get to experience what services I am giving out, but also what services I am getting back from other services. So it's very important. But I wanted to touch on the working culture and what the NHS is about. But I'm sure other presentations will touch on that too. But essentially, what the NHS is trying to get at is as a comprehensive service that is available, as Charlotte says, to everybody, irrespective of ethnicity, gender, religion, sexual orientation, age. And that's why the NHS is essentially a very renowned worldwide, and it's one of the best services in the world. Although it can have some difficulties at times, but it is a fantastic service. And it works on core values that is essentially instilled into you throughout training, and that's how you learn about them throughout the years. And the most important things is safety, and safety comes first and foremost. And then obviously having to maintain confidentiality, professionalism, and everybody is accountable. But again, communication is something that I've learned from year one in medical school, and in the last 15 years, communication is very, very important. And everybody is, throughout my training, everybody communicates very well, everybody's approachable. Although, I may have a different background to others, different religion, I've worked with many different people from different backgrounds, from different cultures, and it's been, the communication is the same. Everybody, emails, face-to-face meetings, but everybody communicates very well. And the communications always require some feedback, which is the NHS is always what on the training programs always trying to get into, to essentially learn from what's gone wrong or what's gone well, and that how we can develop things to go forward. And that is something that, although these are all headings and titles, but this is something that you learn throughout the training years, and this is how you get a world-renowned service. In terms of my experience in the culture and working there, I've had a very positive experience being from, you know, a different background, different culture, maybe different religion, but my experience is slightly, has been fantastic and positive being in the NHS, but also I'm not the only one in the family. My family is essentially the old doctors, other than my mother, who's a biochemist. But my father is a consultant in the NHS. My two sisters are doctors. One of them is a GP like Charlotte, and the other one is a pediatrician she's in the final year of pediatrics training, and she's going to be a consultant. Their husbands are my brothers-in-law. One of them is a consultant. Well, both of them are consultants in the NHS. One of them is a gastroenterologist, and the other one is a neurologist. All of us, I may have had the easiest pathway because I started university in the UK, whereas everybody else in my family, they did their university back home in Iraq, and they finished their university training in Iraq and then moved to the UK afterwards with different experience. So my two sisters, they didn't have any experience working in Iraq as doctors, but once they finished their medical degree, they moved to the UK and did their to equalize their training. They did the PLAB 1 and PLAB 2, and they essentially passed that and applied for jobs like in foundation years. And that's what you tend to do if you don't have any medical training. Whereas my eldest brother-in-law, he finished training in Iraq in university and did experience in Iraq as a medical doctor and gained some experience and skills. So when he did his PLAB training, and he was certified by the GMC to work in the UK, he got through not the foundation program, but I think the second year of the foundation program and the core training. So just gained the experience, gave the evidence that he got the experience, and just applied through the application to core training. Although it was much easier and less structured in the past, now it's a lot easier and more structured, depending on what skills and experience you've had. But everybody got into, once you get into the system, you pass your PLAB and you get into a training program, essentially you are in the system. So, and the system will take you to the levels that you want and what you aspire to do in the future. There are plenty of opportunities in the NHS. There are so many specialties, so many subspecialties, and there are in each city, town, village, there is a job for you. If you, depending on what you like, you want to be in the city, you want to be in the suburbs, you want to be in the countryside, there is always a job there. Whether you are a GP, a general practitioner, whether you want to work in a smaller hospital, or you want to be working in a massive hospital, a massive centre with extreme, services and resources. So everything is there, but everything is organised. Everything is available online. There is nothing hidden. There is no. The system wants to help you. The system wants to get you trained well to be, that next doctor you're going to look after the next generation. So everything is fair. There is nothing in your application, or most of your application, you don't have to, there is no need to give any information about your background in terms of, ethnicity, your height, your weight, your, everybody is welcome. Everybody has a fair chance. but also importantly, the training is so structured. No matter how bad or good you are, everybody will have the right skills and the right training by the end of the 5 years or 7 years of your training. So there's no fear of, oh, what's going to happen at the end of my training? Oh, I may not have the skills. Oh, there's always something extra you can do, or you can always go to that conference or that course to get you what you want. And if you aspire to do extra things, if you want to be in big places, if you want to work harder, again, my motto is always, sky is the limit. You aim for the sky and it takes you a long way. And on that note, I just wanted to reiterate there are a lot of benefits, again, working in the NHS, like Charlotte had mentioned before. There's a lot of benefits, including discounts if you're into your online shopping, or if you like to buy the extra gadgets or the laptops. It's, you know, you'll have, the NHS will look after you. So that is the end of my presentation. I think I'm just over time.
Okay, thank you, Dr. Sam, for your nice, very clear presentation, I guess. Okay, for Dr. Sam, I think it's very nice to hear that you say that you have training, study, researching, as well as getting paid. Am I correct? Yeah.
That's right.
Yes.
That's right. I'll have to say that not every single research job will come with funding, but it's always important to know what research job you're going for and where and who you'll be working with, because that will essentially, the majority of people will get funding even if they start with no funding. Your supervisor, essentially they spend all the years or their life knowing how to get into this, because they know if they don't get you funding and money, you can't live and you can't train and research. So that academic work is nobody's going to be able to do it. So they work very hard for you and with you to get you the funding that you need. It's always good to get the funding to start with, and that these will be very attractive jobs, but obviously they will be very competitive. But then again, once you get into a job, even with no funding, you will get funding depending on what job you're doing.
Okay, maybe I'll try to speak in bahasa. Jadi rekan-rekan dokter sekalian, sangat menarik bahwa ternyata memang ada sedikit perbedaan ya di antara UK and also Indonesia. So, dan dari Dr. Sam menjelaskan juga many of his brother and sister, I guess, sisters, right? From Iraq and then coming to UK as a doctor. Jadi sangat terbuka sekali bila mau melakukan pursue career in UK is very open, because Dr. Sam also said that the system is open and fair and is designed to help you, so there's no fear. Okay, I think according to our schedule, we have about 5-minute break. For the participant, I would like to talk in bahasa, which is nanti akan dapat file. Jadi tadi sudah ada beberapa yang chat secara pribadi. Is there any file? Masing-masing orang akan mendapatkan filenya beserta dengan sertifikat. Jadi di email nanti bisa dicek untuk link sertifikatnya. Harap menunggu sampai akhir sesi ini. Jadi kita nanti masih ada lanjut 2 sesi lagi. Kemudian ada sesi diskusi. Dan terbuka sekali untuk teman-teman. If you want to talk in bahasa, if you want to ask in bahasa, please do so in the chat room. Teman-teman bisa, atau saudara-saudara sekalian, rekan-rekan sekalian bisa tanya di bagian chat room dengan bahasa Indonesia, so that we can help you. Jadi kami bisa membantu Anda untuk menanyakan dalam bahasa Inggris seperti itu. Okay, I think we will have about 5-minute break. Sebelumnya, mungkin yang mau ke kamar mandi ataupun yang lainnya bisa ditunggu. We will back for about 5 minutes. Thank you. Hello, everyone. Thank you for staying with us until this session. We would like to proceed with the next session, which is we have Dr. Celynka here. Hello, Dr. Celynka.
Hello, how are you?
Good, very good. Oke, mungkin kita mau ngobrol bahasa Indonesia kali ya. Oh my God. Oke.
What's happening there?
Technical difficulty. Let me just check it out. Okay. This is better.
Oke, gak apa-apa. Santai.
Oke. So kita sudah bersama dengan 178 dokter di sini ya, insya Allah. Kita akan lanjut ke sesi berikutnya. We would like to proceed to the next agenda, which is Great Global Hanlyn Introduction, begitu ya, oleh Dr. Celynka. Nah, mungkin untuk teman-teman yang tadi banyak bertanya, so many question. I think it is related to the pathway ya. Mungkin pathway-nya, mungkin teman-teman yang baru join di sini masih agak-agak sedikit bingung. Dr. Celynka will try to explain what Great Global Hanlyn may and will help you about to pursue your career in UK. I guess something like that, Doctor?
Yeah, sure.
Okay, maybe you can proceed with your presentation. I think you have 10 minutes.
Okay. All right. Hello, everyone. Thank you for joining this webinar. My name is Celynka Finlanda. I'm currently doing volunteer in COVID emergency hospital in Surabaya. But right now I'm helping you guys to help you to pursue your dreams by working in the UK. And I would like to thank the speakers, Dr. Charlotte and Dr. Sam, also Simon, to be able to participate in this webinar. Thank you very much for your time. And all right, let's continue. So I'm here. We'll tell you a little bit about Great Global Hanlyn. So next slide, please. All right. Okay, as you can see, I'm the president director of GGH, as I call it. We have Simon as advisor, Trigo as the vice president director, and the team with Triami as the head of operation, Reza of the head of IT, and Muhammad Ahod and treasurer, also Badila in this team. And next, please. Okay, so who are we? Great Global Hanlyn is here as a worldwide healthcare special recruiter to help clinical professionals wishing to develop. As you know, that we are helping you doctors who are interested in pursuing your career in the UK, whether as a GP or specialist or taking PhD in the UK, we will help you to achieve this. Next, please. This is our goal. And next, please. All right. Yeah, next, please. Okay. Whew. All right, that's me, but that's not important. Next, please. Yep, this is the time for Indonesia to name ourselves in the UK. And then why choose GGH? Because easy online application, inclusive package program, access to grants and loans, and also get your chance to be a specialist. So for you that who haven't visited our website, please do so. There's a lot of information there. From the easy online application, it's there, the news is there, the package program is there. Please check our website at greatglobalhanlyn.com. And yeah, find your information on our website. Next, please. Yeah, this is very important for the doctors here. I will explain a bit again, but thank you for Dr. Charles to start this webinar by explaining the pathway. So the first thing you gotta do, also, of course, be a fully qualified doctor in Indonesia first, and have at least 1 year post-qualification experience. This is equivalent as internship in Indonesia. And then prove your English language skills. For doctors, we have to have this IELTS score, and we have to be have this minimum IELTS score in 7.5. This, well, very high, but you can achieve this very easily. And then register with GGHanlyn in our website. Please check our website again and send your CV, send your application there, and we will help you. We'll help you step by step. And after that, you will have to do your PLAB 1. You will have to do the PLAB 1, but we have this package to help you to it's like to achieve to pass the PLAB exam. We have this program, so we will provide you with materials to pass the PLAB 1. We have the materials to pass your PLAB 2, and also there's also a program even after you are already passed your PLAB exam and already registered in NHS. You will still be able to do to receive materials for your specialty program. So it's all included in one. And then after you have already done your you're booking your materials program with GGHanlyn, then you can book your flight to the UK and apply for the visa. And you will have 2 weeks course in the UK to prepare you taking the PLAB 2 exam. So you'll be done your PLAB 2 exam in the UK. After that, if you pass your PLAB 2 exam, then you will already register in GMC, and then it's all done. Next, please. Okay. And yeah. Oh, so the PLAB 1 is basically our CBT exam. So when you're done your UKM PPD, PLAB 1 is CBT, right? And PLAB 2 is OSCE. So that's the Indonesian language for this exams. Next, please. Next, please. There you go. And this is the package I was talking about. So you have to pay for £1,100 for these materials that will include your preparation for your PLAB 1, preparation for your PLAB 2, for your specialty program, and it's also included for your 2 weeks course in the UK. That will be included for the accommodation, transportation, excluding the flight and the visa, but it's all in one package with £1,000. Next. Next, please. Okay, next, please. Yeah, as you can see, or as you can see in the previous slide, it was the place for your accommodation, partnering with Apollo Buckingham University. You will be staying in there. For those who are taking the program, and yeah, this is it. I think all of you must be wondering about the salary, because yeah, as you can see, so if you are already registered with NHS and then you're doing your foundation year, you will be receiving at least roughly 581 juta per year. So you'll be working, you'll be studying at the same time, but you will earn something for yourself. So you will survive there. Don't worry about eating ramens there, because you will have your own salary while doing this foundation training. So don't worry. And then, and then the specialty training. Yep, of course. Ya bisa dilihat 872 juta per tahun ya. Dan untuk yang specialty doctors, yep, ini lebih tinggi lagi karena sudah specialty doctors. So in a year you will receive roughly, itu banyak banget bisa dilihat. Okay, yeah, for GP like Dr. Charlotte, you will earn about up to 80 grand per year. Next, please. Next, please. Hello. Okay, we're done. And yes, please check our website for all the information that you need. And also, please ask anything in the chat section. We will try to answer all of them like in this webinar. Thank you for your time.
Okay, thank you, Dr. Celynka. Very great presentation, I guess. Dr. Celynka, I think there are some participant that is not from Indonesia. Will be, apakah bisa? Will they able to contact GGH for information regarding this training program, maybe? Because
Yes.
I see that there's from India and also Nepal here.
Yes. Yes, I seen it. Just check our website and send your application there, send your CV there, and we'll take care of it.
So for any one of you that is not currently living in Indonesia or not Indonesian nationality, you can also, Great Global Hanlyn also will help you to pursue your career in UK, I guess.
Yep.
Sure.
That's
okay.
correct.
I think we would like to proceed with the Simon Yates presentation. He will talk about medical training program. Hi, Simon. Are you there? I think you're still muted. Great, thank you.
Hi, good evening, everybody. Salamat malam.
Selamat malam.
Hi, my name is Simon Yates, and I'm an advisor to GGHanlyn. I live in the town of Crewe in the United Kingdom, and if you join us on the PLAD 2 course, you'll be coming to my hometown to have your 2 weeks here. I've spent all my working life in healthcare management, including as the chief executive of an NHS trust here in England. You may well have guessed that that quite a lot of the presentations today are a family affair, because Dr. Charlotte is my daughter and Dr. Sam is my son-in-law. I don't think Dr. Celynka is part of my family. Not yet, anyway. Today, I want to talk to you about the National Health Service in the UK. And if I can have the next slide, please, Dilla. Every 5th of July is a special day for the National Health Service in the UK, because it's on this day in 1948 that the Minister of Health Anira and Bevan, launched a new healthcare system which is free to the people when they need it, irrespective of their ability to pay. This year, the most influential health organisation in the UK has marked its 72nd birthday of its creation, and amid the global pandemic, the NHS and its key workers have supported the nation by working to the fullest in the battle against COVID-19, as well as every other disease. Over the last few months, the NHS has stepped up and adapted by delivering services differently following the lockdown, recruiting tens of thousands of more staff, including many people who had retired from their jobs in the NHS, and by also taking on volunteers to cope with the pandemic. The NHS used all its resources in responding to COVID-19 by building emergency hospitals and entering into collaborations with the independent and private hospitals that also operate in the UK. To appreciate those commitments, people in the UK have had many ways of saying thank you to all the workers in the NHS. And I'd like to show you now a short clip of film so you can see how that has been achieved. Can we see the video, please, Dilla? Thank you, Dilla. And now some of you may have recognised that that small aeroplane was the famous Spitfire, which is responsible for winning the Battle of Britain in 1940, when the UK was at its most dangerous position. Can I have the next slide, please, Dilla? In marking its 72nd anniversary, the debate about the NHS has resulted in a long-term plan being developed. There's been pride in our health services enduring success and in the shared social commitment it represents. There's been concern about funding, staffing, increasing inequalities and pressures from a growing and aging population in the UK, but there's also been optimism about the possibilities for continuing medical advance and better outcomes of care. And in looking ahead in the health service, the NHS has developed a long-term plan that keeps all that's good about our health service and its place in our national life, but which tackles head-on the pressures our staff face, and whilst making our extra funding go as far as possible. And the plan sets out a number of ways in which the NHS will do that. Can I have the next slide, please, Dilla? Chapter 1 sets out how the NHS will move to a new service model in which patients get more options, better support, and properly joined up care at the right time in the optimal care setting. You know, GP practices and hospital outpatients currently provide around 400 million face-to-face appointments each year. And over the next 5 years, every patient will have the right to online digital GP consultations, and redesigned hospital support will be able to avoid up to 1/3 of our outpatient appointments. The additional money in the health service will be used to deal with pressures in primary care and extend the range of convenient local services, creating genuinely integrated teams of GPs, community health and social care staff. New expanded community health teams will be required under new national standards to provide fast support to people in their own homes as an alternative to hospitalisation. We have an emergency care system under real pressure, but also one in the midst of profound change. And the long-term plan sets out action to ensure patients get the care they need fast and to relieve pressure on A&Es. New service channels such as urgent treatment centres are being designated across England for those that do not need hospital care. And this model will be rolled out across all acute hospitals over the next few years, building on our hospital's success in improving outcomes for major trauma, stroke, and other critical illness conditions. Next slide, please, Stella. Chapter 2 of the long-term plan sets out new funded action the NHS will take to strengthen its contribution to prevention and health inequalities. Wider action on prevention will help people stay healthy and also moderate demand on the NHS. And action by the NHS is a complement to, not a substitute for, the important role of individuals, communities, government and businesses in shaping the health of the nation. Nevertheless, every 24 hours, the NHS comes into contact with more than 1 million people at moments in their lives that bring home the personal impact of ill health. And the long-term plan funds specific new evidence-based prevention programs, including to cut smoking, reduce obesity, and to limit alcohol-related A&E admissions. Next slide, please, Dilla. Chapter 3 of the plan sets the NHS's priorities for care quality and outcomes improvement for the decade ahead. For all major conditions, results for patients are now measurably better than a decade ago. Childbirth is the safest it has ever been. Cancer survival, and I know this from my own personal experience, is at an all-time high. And deaths from cardiovascular disease have halved since 1990. But the biggest killers and disablers of the population in the UK are still unmet need and unexplained local variation. These facts, together with patients and the public's views on priorities, means that the plan goes further and focuses on improvements in cancer, mental health, diabetes, and aging, including dementia. But it also extends a focus onto children's health, cardiovascular and respiratory conditions, and learning disability. Next slide, please, Dilla. Next slide, please, Dilla. Thank you. No, sorry, my mistake. Thank you. Chapter 4 sets out how current workforce pressures will be tackled and staff supported. And I guess this is very interesting for you all listening here today. The NHS is the biggest employer in Europe and the world's largest employer of highly skilled professionals. But our staff are feeling the strain. And that's partly because over the past decade, workforce growth has not kept with the increasing demands on the NHS. There are practical opportunities to put this right. University places for entry into nursing and medicine are being expanded. And the long-term plan sets out action to expand the number of places, ensuring that well-qualified candidates are not turned away, as happens now. International recruitment is being significantly expanded over the next 3 years, and the Workforce Implementation Plan sets out new incentives to recruit to shortage specialties. Now, many doctors will join the NHS through training programs, of the type that Charlotte and Sam have explained. But many other doctors join the health service on jobs which are not part of training programs. They gain their experience in the NHS and then have a much improved CV to then be able to apply for training programs. And over the years, I have known many doctors who have joined the NHS in this way from countries all over the world and are now working in senior positions and are consultants in some of our most prestigious specialties. Next slide, please, Dilla. Here's a short video about life as a surgeon in the UK.
I'm Duncan Light, I'm a surgical registrar. My role involves sort of seeing patients directly, examining them for any findings that I think are important. From there, we may decide that that patient may need an operation, so the other main part of my role as a surgeon is that we do surgery. So in a typical sort of morning session, I would probably see about 10 to 20 patients, and that would usually finish by lunchtime. And then in the afternoon, I would then perhaps have an operating session where we would do maybe 2 or 3 procedures. When I was at school, I managed to do a work placement on a surgical ward, so I was able to speak to junior doctors and senior surgeons at that time about what the job involved. Being informed and being able to speak to the right people is crucial. Medical school gave me a good grounding. It helped develop my communication skills and my general medical knowledge. But I think another thing that really drew me to surgery is that it's very much a postgraduate discipline. And I think knowing that I could develop a further and specific skill and knowledge set, that was particularly appealing for me. There's a variety of people that can lend themselves to the type of surgery you need to do. I've noticed the benefit of having people who are more sort of people-orientated in their communication, but then also working with people who are more academic, or even people who are just very specifically focused on a procedure. All those different people can bring skills into the environment. I never thought I'd be running an operating theatre, teaching trainees independently and coordinating a complex operation.
Thank you, Dilla. Next slide, please. Thank you. The final chapter I wanted to refer to of the long-term plan sets out a wide-ranging and funded programme to upgrade technology and digitally enabled care across the NHS. And these investments will enable many of the wider service changes which are planned. Over the next few years, they will result in an NHS where digital access to services is widespread, where patients and their carers can better manage their health and condition, and where clinicians can access and interact with patient records and care plans wherever they are, with ready access to decision support and artificial intelligence. Our National Health Service was founded in 1948 in place of fear, the fear that many people had of being unable to afford care for themselves and their families. And it was founded in a spirit of optimism at a time of great uncertainty, coming shortly after the sacrifices of war. At best, our National Health Service is the practical expression of a shared commitment by the British people over the past 7 decades, there when we need it, at the most profound moments of our lives. But as medicine advances, health needs change and society develops. The health service continually has to move forward, so that looking forward for the NHS in a decade's time, we have a service that is fit for the future. And can we just show the last video, please, Dilla?
The NHS belongs to the people.
It is there to improve our health and well-being,
supporting us to keep mentally and physically well.
We search for the things we can do, however small, to give comfort and relieve suffering.
To get better when we are ill.
And when we cannot fully recover.
To stay as well as we can till the end of our lives.
It touches our lives at times of basic human needs.
When care and compassion are what matters most.
Access to NHS services is based on clinical need, not the ability to pay.
Available to all, irrespective of gender,
race, disability, age or sexual orientation.
Respect, dignity, compassion and care should be at the core.
Patients come first in everything we do.
We make sure nobody's excluded,
discriminated against,
or left behind.
You have the right to receive care and treatment that is appropriate to you.
You have the right to access NHS services.
You have the right to be treated with dignity and respect.
we will be empowered to put forward ways
to deliver better and safer services for patients.
We do not wait to be asked because we care.
Thank you, Dara. My last slide, please. So come and join us in the NHS, and I hope you've enjoyed the presentations you have heard today. Terry Marcassi.
Thank you very much, Simon, for the very nice presentation. Okay, I think this is the time we have about 20 minutes to do discussion. Dr. Charlotte and Dr. Sam, are you here with us? Okay, hello, Dr. Charlotte and Dr. Sam, are you here with us?
They might not be, because I know that they've got family appearing, and it might be that my one-year-old grandson is not making them available.
Okay, all right. I think maybe Dr. Celynka and also Simon, may you be able to answer for them, I guess?
Yeah, sure. Yeah.
Okay.
Simon, do you want to start? Or me?
Oh, hi.
Sorry.
Oh, we're afraid that you're occupied with the little son you have.
Oh yes, keeping us busy. So we might have to swap back and forth. So I'll try and answer the questions about GP and sort of training, and then if once I've finished that, then I'll go and grab Sam and we'll.
Okay. Okay, sure. Yeah, I think there is a question from Risky NM, which is, let me see. Okay, this is, let me see with Gasani. I guess you have answered it before, which is, how is the way to determine the job location for international doctor in UK? Can we choose, or based on what? Is there any minimum clinical experience requirement before applying PLAB? Thank you.
Is that a question for me? Sorry.
Yes, that's a question from for you, Dr. Charlotte.
Oh, I'm not sure about the requirements for PLAB. Sorry, I think Sam might know that.
Okay, sure.
Sorry.
Maybe Simon.
I can't answer that, but yeah.
Go on, Celynka.
Maybe you can proceed with another questions for Dr. Charlotte, because she has a little kiddo that she has.
Okay, I think because Dr. Charlotte has answered some of the questions, let me try to see.
Yeah, she has answered in the chat room.
Yeah, I think I've tried to go through most of them that are sort of relevant for me and answered in the chat.
Okay.
Maybe you can explain it again, Charlotte, please.
Yeah, no, that's fine. Okay, I'll just go through some of them.
All right, okay.
Okay, so with regards to COVID, somebody asked about how the training and applications and things are varying. As far as I'm aware, all of the training programs are carrying on as normal. So I know that there was a time when some of the trainees, say for example, the GP trainees that I work with, some of them had to go back to hospital rotations, and other high risk doctors who were more at risk of COVID came to work in general practice. So I know that at one point there was a bit of disruption, but I think what they're trying to do as much as possible is still include that in the training time. So they're trying to see what competencies you are able to get during that time, so that people aren't negatively impacted. As far as recruitment and training, it will all carry on as normal from now. So the recruitment process is still ongoing. I think a lot of it is happening more virtually. So I think a lot of the face-to-face interviews were cancelled and were then offered over Zoom and things like that. I know that some of the exams were paused for a while, but from what I've heard, I think they're starting to reintroduce those with social distancing where they can. So I think definitely the past sort of 5 months, there was some pause in that, but it's starting to pick back up as normal now. Yeah, so our GP trainee in our practice, so she couldn't do her final exam as she normally would. So they changed the way they wanted them to pass. And last night she got the confirmation that she's passed. So they're trying to do as much as possible to keep the training scheme going and flowing as they can. Yeah, so I think that was one of the questions. Somebody I think mentioned about non-training jobs. I think my dad can probably answer that separately. So somebody asked about how GP trainees working in emergency medicine differ from emergency medical trainees. So essentially everybody at the same level will be on the same rota. So when I was working in emergency medicine, I was on the rota with the emergency medicine trainees at the same level. So we'll all have the same rota, we'll all have the same tasks and jobs to do. So, I mean, basically in emergency medicine, you just clerk people all night long, initiate the basic investigations and management, and then refer to the specialty if needed. So everybody who's on that training, no matter what specialty you're actually doing, will have the same roles. The only difference really is what additional teaching and training your specialty will offer. So every Thursday afternoon, I was excused from the A&E rota so I could go to the GP training. And I think that A&E trainees had a day a month where they then went separately off the rota to go and do their training. And the other difference would be, so in GP practice, in training, there's certain competencies we have to meet. So we have to do, say, for example, 10 abdominal examinations, 10 PV examinations, that type of thing. So we would still have to do that in the emergency room, and the emergency specialty trainees would have maybe different competencies to get. So they may need to get, you know, a number of trauma assessments, you know, other things that are more specific to their specialty. So we're on the same rota, but we may have different aims to get out of the rota, if that makes sense. Let's have a look. So I think, so the website I spoke about, I've written it in the chat. So it's called the Savvy IMG. It's really useful. So a lot of the questions we've been asked, the answers will be found on there. But in general, there is either you have to match the competencies for a UK trainee, or some people have a period of working. So a lot of them will be taken up in the emergency department or acute medicine, so they can quickly get signed off for the competencies that the UK doctors would have covered. Some people do that in sort of a 6 or 12 month basis, but it depends the specialty training as to what competencies they'll need. So all of the Royal College websites and things will have that information and say what it is that you need. What else? I think there was a few questions about just in general international medical graduates. So once you're applying, as long as you meet the exact same criteria, you have the exact same chances as the UK graduates. So it's not that there's jobs for UK graduates and jobs for everybody else, as long as you match the competencies. So if you had a number of international presentations, publications over a UK graduate, you would get that job over them because you would have more to offer that training program essentially. And there's a way that it's scored. So again, you can find this online, but depending on if you've got audits, research, publications, presentations, you'll score more. So then when you apply for specialty training, you'll have a better chance at getting the jobs you want in the area you want. And then the less you have, you may end up in an area you don't necessarily want, or you may end up with rotations that don't necessarily match what you wanted. But you would still get the job if you met the criteria. What else? I think somebody else had said they've completed the internship in their own country. So I know that on the foundation program website, if you have a look, there is a separate part where if you've completed an internship, sometimes you can apply directly for FY2. So you sort of skip that year, but you'll have to look specifically at the criteria on the website if your internship has met that. What else? Sorry, I'm talking fast.
I think you answer almost everything.
Yeah, I think.
Can I pick up a couple of things about the criteria for PLAB and also non-training jobs? On the PLAB exams, first of all, irrespective of your experience in Indonesia or any other country, you have to pass the PLAB 1 and PLAB 2 in order to be registered with the General Medical Council and work in the UK. Now, what we say is 1 year's post-qualification experience. And then if you register with GGH, we'll be able to provide you with the online materials, which will help you pass PLAB 1. And then you can then come to our 2-week residential course in Crewe to do PLAB 2. When you pass PLAB 2, you are then able to register with the General Medical Council, and everything then is available for you. But the additional thing, of course, that we offer is that when you are registered with the General Medical Council, we will help you to apply for training programs, and we'll also help you to apply for non-training posts. If I can just say something about the non-training posts. There are many, many doctors working in the UK who are not part of training programs. They receive additional training and study leave, but they are not part of any formal training program. So they're in the same position year after year after year. What we found in the UK is as the training programs have developed, those doctors in non-training programs who are often overseas doctors then have the experience to be able to apply to join training programs. And as I said in my presentation, I know many, many doctors who've come from overseas, been in non-training jobs, and then been able to transfer. In fact, many years ago, one of Charlotte's mentors, who was a respiratory physician from Bihar province in India, who took notice of Charlotte when she was a 14, 15-year-old and provided her with some experience in a hospital. He went through exactly that route. If I can also just quickly say, as I'm speaking, let me just tell you something about Crewe, which is where you will take the PLAB 2 course. Crewe is a small town in the northwest of England, about 30 miles from Manchester. Crewe's got a number of unique features, and one of them is that over 100 languages are spoken in our town. There is quite a sizable East Timor community. There's a Bangladeshi community, there's a West Indian community, and there are a lot of people from Eastern Europe who live in the town as well. We are a very, very diverse, cosmopolitan population, and you will enjoy the experience of being with us. Thank you.
Yeah, just to add, sorry, I was just going to add, so when I did particularly my emergency medical rotation, there was a huge number of international graduates who'd come, and their first job in the UK was emergency medicine, so that they can get the competencies. So there was a huge number, and actually quite a few of them then joined my training program afterwards. So once they'd completed their competencies, they then came onto the general practice training program. So I think it's really important to understand that the NHS is so diverse and accepting that actually it doesn't matter where you're from or who you are or what you've done. You know, as long as you can prove that you can meet the criteria, everyone's welcome. Oh, sorry, and just one more point. I think somebody else had asked about specific like international medical graduate support and things. So I know that in my general practice training program, there was an international graduate who was one of our mentors, and she then developed a role where actually her role was then to support the international medical graduates going through the GP program, and maybe offering them additional training that was as on top of the usual training that we had. So sometimes that was communication skills, because often people will use slang, or you know, sometimes we have funny phrases that don't quite make sense, and you know, she helps people like that. So I'm sure that other training programs will have similar as well for that additional support.
Okay, thank you very much, Dr. Charlotte and Simon. I think there's one good question from, let me see, David Kera. David Kera is a surgeon from Indonesia, and he wants to know if it is possible to pursue a subspecialist program in oncology surgery in UK.
Yes, for sure.
For sure, yes.
Yeah.
And I think Dr. David Kera is still here, so maybe you can try to contact the Great Global Hanlyn number at the below chat. You may contact them. And there is this one question asking about Dr. Charlotte. Is there any website where we can get more information about the program? Is it the CV, you mean?
Yeah, so okay, so so the foundation program alone, there's the foundation program website. Let me just see if I can find it. It might just be as simple as www. I'll just find it for you. But yeah, so there's this a website that I really recommend, that some of my international medical graduate friends use, called the Savvy IMG, and I've put the website in the chat box. So a lot of the questions that were coming up are covered there. So I think a lot of the questions that have been asked, obviously lots of other people will have asked those. For more information about the foundation program, it's www.foundationprogram.nhs.uk, and that will cover sort of programs, curriculum. There's a whole sort of question and answer area there, and I'm sure there'll be a section for international medical graduates as well. But the Savvy IMG has lots of questions that people have asked about, you know, how are your skills that you've already developed transferable, and what you'd need to do from there.
Okay, I think we'll proceed with the question for...
If you're looking for the website as well, don't forget that the word program will be spelt in the English way, not the American way. Okay, we're real English, rather than
real English. Yep, right. Okay, Tia.
Okay, and then there's this question about maybe I think for Simon or for Dr. Celynka. If we want to be a scientist or a postgraduate program, I think this one is from India. I want to know what is the difference if we take fellowship in the UK after pursuing post-graduation out of UK versus doing the post-graduation in UK. How will it affect the job opportunities?
It shouldn't affect it at all. What's important when applying for jobs in the UK is, of course, having the General Medical Council registration. But as I think, as Sam said in his presentation, the more experience you have and the more you can demonstrate about your own individual skills and talents, the more likely it is that you will get jobs before other people. I mean, Sam is a really, really good example of this, because what he knows is to at the end of his training, to be able to get the consultancy in neurology that he would like to have, he needs to have additional qualifications like his PhD, so that his CV is so much better than the other competitors. Just like any profession, the higher you go in the profession, actually, the more competitive it is. And you have to be able to demonstrate that your skills are that much better than anybody else's. Where you get that qualification from, it doesn't matter as long as you have it.
Okay, very nice explanation. I think this one is for Dr. Celynka mungkin ya. Let me ask you in Bahasa, is it okay?
Yeah, I think I will explain the whole thing in Bahasa.
In Bahasa, because some of our friends are quite confused.
Oke, jadi ini programnya banyak banget ya, maksudnya pertanyaannya banyak banget. Mungkin mulai dari pathway-nya ya, aku jelasin lagi. Jadi kalau misalkan untuk registrasi di UK itu kalian harus ngambil PLAB 1 and PLAB 2 exam. Itu kayak CBT sama OSCE-nya UKMPPD. Itu harus wajib dua itu diikutin. Ya, setelah itu kalau misalnya kalian lulus, nanti kalian akan masuk dikenalkan dengan namanya Foundation 1, Foundation Year 1, and Foundation Year 2. Nah, itu ekuivalen dengan internship, bukan koas ya, bukan dokter muda. Ekuivalennya sama internship. Jadi pas lagi kalian mungkin ada beberapa orang yang sudah menyelesaikan internship-nya ataupun udah GP udah jadi lama kan pasti udah internship tuh. Nah, untuk apply ke Foundation Year 1 itu emang ada beberapa spesifik rotation. Seperti contohnya Foundation Year 1 itu pasti ada requirement 3 bulan rotasi di emergency, 3 bulan rotasi di bedah, dan 3 bulan rotasi di geriatrik. Itu pasti ada. Nah, kalau misalkan kalian sudah melewati itu, berarti ya bisa lanjut ke Foundation Year 2. Jadi tergantung apa yang kamu sudah lakukan di internship dan ternyata sudah match di Foundation Year 1, kalian bisa skip ke Foundation Year 2. Gitu. Jadi kalau misalkan secara gamblangnya ya, kalau misalkan aku belum apa-apa misalkan ya, jadi kamu harus ikut PLAB 1, PLAB 2, Foundation 1, Foundation Year 2 itu harus untuk registrasi di GMC kayak gitu. Nah terus tadi itu ada yang nanya kalau yang international medical graduates, yes, you can still apply through GGH. Just check our website, match the requirements there, send your CV there. It's all there. All the information is there. Just make sure that you have everything that the requirements needed. And also ada yang nanya juga tentang masalah mana tadi ya?
Dr. Celynka.
Yeah.
Dr. Celynka, maybe this is quite cukup nyambung juga. This is a friend from India, which is so Indian MD degree can be recognized in UK. It mean that I would not require to give the PLAB again to apply for a job.
Sorry.
So she's dari India, kemudian sudah MD, medical doctor in Indian, apakah tetap harus PLAB again?
Yes.
So, okay. Any Indian post-graduation degree masih tetap harus PLAB again?
You have to be registered with the General Medical Council to apply for a job in the UK. And to be registered with the General Medical Council, you have to have PLAB 1 and PLAB 2.
Okay.
Exactly.
And then
mau nambah satu lagi karena ada beberapa yang nanya juga untuk masalah kayak misalkan mereka masih student di sini terus ataupun ada yang lagi internship dan post internship itu juga nanya tentang persiapan yang paling penting adalah IELTS itu yang paling penting di sini karena di sini requirement buat doctors it's 7.5 to 8 IELTS ya. Itu paling penting, itu requirement persiapannya yang harus dipersiapkan. Nah, terus di GGS itu juga menyediakan program yang akan mempersiapkan kalian dari pertama PLAB 1. Jadi kamu dapat material secara online karena ini kita masih era COVID. Jadi semua material akan disediakan melalui online untuk PLAB 1. Nah, terus nanti kalian exam PLAB 1-nya sit on the PLAB 1 exam. Nah, terus yang untuk persiapan PLAB 2-nya itu 2 minggu yang di UK, yang di Crew itu sudah termasuk semuanya. Nah, terus ada satu lagi contoh buat Mbak Dila, mungkin bisa tolong ditampilkan ya. Ada satu file yang harus ditampilkan. Mbak Dila mungkin bisa ditolong tampilkan. Nah, ini menyangkut foundation year 1, oke? Jadi emang teman saya lagi menjalankan lagi gara-gara ngomong bahasa Inggris jadi pusing lagi menjalankan foundation year 1-nya. Jadi ini contoh modul foundation year 1. Jadi bisa dilihat ya, ada counter fraud, bribery, bla bla bla, equality, diversity, healthy. Ini yang akan kalian tempuhi selama foundation year 1. Ada satu lagi Mbak Dila mungkin bisa ditunjukkan. Ada satu foto lagi. Mbak Dila? Bisa? Satu lagi? Nggak ada. Ya, jadi untuk yang masalah era COVID, emang sebelumnya, ya seperti ini ya. Jadi emang sebelumnya Flap 1 itu sempat ditunda karena benar-benar masih menyesuaikan dengan kondisi. Jadi untuk sekarang itu Flap 1 tetap dilaksanakan seperti biasa. Dan ini untuk foundation year 1-nya juga tetap dilakukan seperti biasa sekarang dengan protokol kesehatannya yang sudah ditetapkan seperti social distancing dan jadi untuk foundation year 1-nya mereka itu juga ya, yang seperti Sam jelaskan sebelumnya, safety-nya di sana sangat oke banget. Jadi sebelum kalian melakukan foundation year 1, even though we are still in the COVID era, jadi kayak kalian harus tetap ada fit test, itu kayak buat yang masker itu, terus abis gitu ini modulnya kalian yang akan kalian tempuhi selama foundation year 1, jadi kayak misalkan equality and diversity and human rights level 1, tapi nanti pasti ada lagi yang lainnya kayak gitu. Jadi kayak terorganisasi gitu loh, terorganisir untuk foundation year 1-nya dalam era COVID ini. Dan ada yang online untuk course-nya, ada yang kalian tetap masuk ke hospital kayak gitu. Sudah dijelaskan semuanya tadi sama Dr. Sam sama Dr. Charlotte. Semoga membantu sekali ya ini ya.
Okay, I think the explanation in bahasa quite help for a bit ya. Membantu sekali maksudnya bahasa. Karena beberapa pertanyaan tampaknya pertanyaannya sama dan hopefully already been answered in bahasa by Dr. Celynka. I think this is 6:07. So we pass our schedule, which is whoop. Thank you for staying with us. We still have about 140 people together being with us today. I think there will still be many questions about this topic, which is you may try to contact Great Global Hanlyn through this social pages. Bisa lewat Facebook-nya, or Twitter, or LinkedIn, or Instagram. And I think because we're currently overdue from our time, we would like to close this session. Is it okay, Dr. Celynka and other speakers?
Yes. Yeah. Thank you very much for your time, everyone. Yes. Please check out our website and our social media. Every information is there.
Okay, maybe there's one last word from Simon or Dr. Celynka or Charlotte or Sam.
I was just going to say, looking forward to meeting you in Crewe.
Okay,
in a few months' time, when everybody can travel again. Ray.
I'm coming in 2 weeks.
Okay.
Okay, that is the end of our session. Thank you for joining with us until today. So if you have any other question, please proceed to Great Global Hanlyn social media. Sekali lagi terima kasih telah berpartisipasi pada acara ini. See you in our next event. Thank you.